And I love talking about the history of medicine, and I love talking about every one of these talks, but I will be completely and utterly upfront about my bias. I like this talk best of all because it's just horrific. So let's just embrace that, and we'll rock it through the history of surgery with reference to some of the things that we've already seen in previous talks. So essentially, the most primitive version of surgery we have any evidence for is trepanation. Now, perhaps societies before we have written records did indeed perform other surgeries, cut into people, try to heal wounds, do amputations, but we don't have any real evidence of that, whereas trepanation left a lasting memorial to those events, and people got better at it over time. People did indeed find ways to make trepanation with obsidian blades and stone actually work, which is evidenced by the fact that we have trepanations that were clearly fatal, no healing, versus ones that have a nice smooth margin, indicating that not only did the person survive the procedure, but they survived long enough to have the bone remodel. As we move forward, we've talked about Hippocrates already, and Hippocrates had a relatively complicated relationship with surgery. He believed that the four humors circulated throughout the body and their relative balance determined your personality, your proclivities, and if they got out of whack, you would wind up being ill, and the physician's job was to reset that. There wasn't a great deal of room for surgery in that process unless you count bloodletting, which was actively done to decrease the amount of blood in the body and hopefully bring it back into its normal state. One thing Hippocrates did do is in the Hippocratic Oath, he forbade his students from, quote unquote, cutting for the stone. And these stones were bladder stones. And there's a couple interesting things about this. First off, he forbade them from doing it, one, because it's a brutal, nasty procedure which cuts into the body. It was something that was not really encouraged in Greek society. And two, it was just brutal. Now, if you were going to go after somebody's bladder stone, what approach would you probably take, knowing what you know about anatomy? Suprapubic? Maybe? They didn't do that. They went perineally. So they went right through the perineum and tried to yank out the stone from between the scrotum and the anus, if it was a male, or just anterior to the anus if it was a woman. So it was a brutal procedure, and the other reason Hippocrates forbade people from doing this, if they were his students, was that there was already a class of people who did this. There were already stone cutters, and the fact is, it wasn't that Hippocrates forbade his students from doing it only because it was nasty, but because they would be poaching off of someone else's professional area. So you've already got a little distinction between types of medical practice, even back in ancient Greece. So we move forward, and the Alexandria in the northern portion of Africa, where Libya currently is, had a very, very expansive library, which was also home to a lot of research, both medical and otherwise. And there were two really well-known anatomists there. There's Herophilus and Erasistratus. I always mess that up. Erasistratus. They were both very involved in anatomical research and came up with a lot of the particulars about the pneumatic theory, about how air is blown through the nerves and inflates the muscles. And in the case of Herophilus, he actually was able to correlate that anatomy had effects that we could be palpating, like the heartbeat and the pulses. He did describe a lot of interesting things, but his works were lost until well into the modern era. And we only really know about what he said based on what other people wrote about what he said. On the other side, we have Erasistratus, who really developed the idea of pneuma, which was really taken to the nth degree by Galen. So we've talked a lot about Galen because he's the biggest name in medical authority for roughly 1,400 years. So Galen had an incredibly complex theory about how the body worked based on pneuma, and that you breathe in air, it gets turned into pneuma as it comes into your lungs, travels to the heart through the arteries, percolates into from the right ventricle to the left ventricle, and then moves up to the brain. It's converted to psychic pneuma, which then is actually able to power the muscles. In terms of surgery, the thing you want to know about Galen is that he did a lot of experimentation. And his surgical researches were actually really sophisticated for the time. Galen gets a lot of bad press for having been this authoritative person who stymied medical research for a long time. And that's true. But he also did some really interesting and unique things. And if people had followed his method rather than his authority, we probably would have had a lot of medical research taking leaps and bounds in the next millennia rather than stagnation. What he did was look at how nerves and muscles interact, and he showed definitively that nerves innervate muscles. If you cut a nerve, the muscle goes dead. He showed that the recurrent laryngeal nerve innervates the larynx, and if you cut it, the animal or person who's had it cut can no longer make any sort of noise. He linked the pneumatic theories to the humoral theories, so kind of brought the pneumatic theory and the Hippocratic theories together to formulate this massively authoritative system that was maintained up until Vesalius came along and debunked it. Now, in the meantime, we have the Greek and Roman empires ascending, descending. Rome was eventually wiped out by the barbarian incursions. In reality, a lot of these barbarians had been invited into the Roman areas beforehand, then kicked out, and then they decided that instead of being killed by Mongols, they would just invade Rome instead. So the Roman Empire fell, moved eastward to Constantinople, to the other seat of the Roman Empire, but at this point, all the high culture in the European and Western Asiatic area was concentrated around Constantinople and the Islamic cities like Damascus and Baghdad. I'm probably leaving a few out, but that's where a lot of medical research took place. Now, in the last session we talked a lot about how the Islamic physicians of this era contributed to categorizing diseases, coming up with better pharmacopoeia, botanical preparations. When it comes to surgery, sadly, there wasn't a great deal of innovation done by Islamic scholars because there was a very strict ban on cutting into the body and trying to use cutting or sharp objects to treat people. One thing that was heavily used because of that ban was cautery. So using hot irons to seal off wounds, to stop bleeding when you have to amputate. Cauterization was something that was innovated there, and because it was really the only game in town, they worked at it to a pretty significant degree. Now, of the people involved, we've got al-Zuhairi, and you'll hear him called Albucasis a lot of times. He was in Cordoba, which is now Spain. One thing about Spain that sometimes people don't realize is that there were Islamic empires in Spain for 600 years. And it wasn't until Ferdinand and Isabella that the Spanish country as we know it more or less came into existence, and they pushed the Islamic and Jewish citizens that were there out into other places of the world. So al-Zuhairi was one of the physicians to the caliph there. He wrote several influential works, and including one that was basically an entire summary of how medical practice should take place. One of the things he did in this book was categorize and actually illustrate a lot of the surgical instruments that were going to be used so that people could actually do the procedures that they could. You might not be able to open up the abdomen or the thorax and investigate, but you could deal with wounds that were already present and try to get them cauterized, tie them off, and we have a lot of these really interesting and somewhat horrific looking instruments cataloged as a result. He actually made a lot of these not by hand, but by working very closely with blacksmiths and other people to come up with these very specific instruments. And he worked a lot of different things to make medical practice better, not just surgery, but medicine. He worked at using catgut to actually create sutures. Sadly, this suturing technique was in his books, but really dropped out of practice in favor of cauterization only. Now, cauterization is not necessarily bad, but what's a problem when you cauterize a wound? What are you doing to it? Yeah, you may be sealing off the vessels that are bleeding, but you're also traumatizing all the nearby tissue. Whereas if you can use ligature to tie off those bleeding vessels, all the rest of the tissue is not damaged in that process and can heal a little more easily. So he addressed dentistry, a bit of obstetrics as well. So really a very influential physician who left a lot of written material behind. Now at this point, medieval Europe was pretty much a backwater, culturally, scientifically. Literature, there were some high points in the Middle Ages, but in terms of science and medicine, not so great. The physicians were the people who were the intellectuals. They did all the thinking, all the diagnosing, and they were on this high elevated pedestal. And I've already beat around the bush, and today I finally get to deliver on it. Who were the people who actually did the work? Barbers, or the barber surgeons. They were usually relatively interchangeable terms. In some places, you had a clear distinction between who was a barber, who was a barber surgeon. But the barbers were people who actually carried out the physician's orders, did the bleeding of the patients, did the cupping, administered the purgatives, gathered urine. You can see that in the picture on the right, that the physician wants to inspect the urine. Physician's not going to go down there and stick a catheter in somebody's penis. No, that's a barber's job. So you have them pass the catheter, gather the urine, and, surprise, barbers also pulled teeth and cut hair. So when we think about barbers today, it's pretty much hair cutting that jumps to mind, but it was only one of many things they did in the Middle Ages when they became a distinctive class of professional. Now I say professional, but they were clearly ranked very far down compared to the physicians. In fact, let me get a show of hands. Who here is an EMT or has been an EMT? Emergency medical technician. Now, would you say that you guys were accorded all the respect and admiration that you were due in attempting to save people's lives in carrying out your duties? Not so much. That's how surgeons were viewed up until this time. So if you think about how surgeons are viewed today, like, oh, my child is going to grow up to be a surgeon, how wonderful. It would be like an EMT now. That's how surgeons were thought of then. EMTs and surgeons were doing great work, but they were not getting any respect for it. They were treated like they were just kind of poorly trained, manual laborers. And in a sense, that's what some of them were. But what's going to happen through the rest of this talk is we're going to chart how surgery not only became more respectable, but also became more scientifically grounded to the point where it could demand that respect. So barbers cut the hair, and in addition to all the things I listed, they added wound healing, or at least wound treatment, to their list of things that they took care of. And in fact, wrapping the bloody bandages around someone's leg was something that they would do rather regularly. Then, when the person would come back, they'd unwrap the bandages, put them out to dry on a pole in front of their door, and that's how you got the barber pole. The barber pole was originally just some bloody rags that had been maybe kind of washed and then hung out to dry, and that was how you knew where to find the barber. So, one bright spot in the history of surgery up until we get to the Renaissance and the Enlightenment was a physician who was working in France, in Avignon, and his name was Guy de Chauliac. I like to say Guy de Chauliac, but it's actually Guy de Chauliac, and he was one of the physicians to the Pope in Avignon. There was a period called the Babylonian Captivity and the Great Schism where the papacy actually moved from Rome to Avignon, made everybody in Rome really unhappy, and eventually it left Avignon, came back, and essentially he was one of the physicians to the Pope while the papacy was in Avignon. And there were not only regular medical things to deal with, there was an outbreak of plague that was very, very massive in the 1300s. And he not only had to treat it, he caught it, but survived, and left a very extensive and very accurate record of what his symptoms were, how it progressed, and how he eventually got better. So he wrote a massive book called Chirurgia Magna, Great Surgery, and investigated every surgical topic that was out there: ulcers, hernias, fractures, cataracts, and he pulled a lot of material from prior experts, including Albucasis, Galen, Al-Zahari, any of the Islamic, Greek, or Latin scholars that he had access to their works, and tried to bring it into his method. However, he was still hamstrung by the fact that everything was based around Hippocratic and Galenic concepts of what disease actually was. And in particular, the idea that pus was not just something that could happen in surgery, it was something that had to happen. So there was a thing called laudable pus, praiseworthy pus. And in that case, you do an incision, it's healing, and you get this thick, whitish, sticky pus. That was considered to be a good thing because it wouldn't spread. It kind of implied that the healing was going to proceed apace and we'd be okay. Not so bad. What's bad is if you had an incision that was healing cleanly without pus, sometimes the surgeon would say, oh, no laudable pus. We got to open it back up. So they'd work until they actually got that sign, or the person got a far more substantial infection and died. So there was really no concept of what wound healing was actually about. Galen had said that pus was a necessary step, and everybody thereafter more or less parroted that idea. So what was happening in Europe was relative stagnation until the Mongols and others wiped out the Islamic high seats of culture like Damascus, Baghdad, and then Constantinople fell, and all the scholars who were in these very, very high culture areas fled westward and landed in the universities that had developed in places like Paris and Bologna and Padua. Padua in particular is going to be very important in the development of anatomy. And one reason I like this talk so much is that the development of surgery can't really proceed that far until you've got sophisticated concepts and understanding of actual human anatomy. And Padua is the place this really came to happen. Now remember that at this point, the universities are set up to teach theology, law, and medicine. Medicine is not surgery. Surgery was not taught as a distinctive part of these courses. Surgeons were people who learned by apprenticeship from other surgeons. And you would really only be as good as your master, as the person who taught you, brought you into their practice, and then sent you along. So essentially, surgery was relatively hamstrung by the fact that, unlike medicine, law, theology, people who did it were often illiterate. Literacy was very uncommon back in the Middle Ages, and even amongst the nobility, literacy was something that was kind of spotty. When you get to the peasantry, really uncommon. So barbers tended to be craft workers. They learned what they could from their mentors, but that was pretty much it. And there wasn't a real drive to innovate or improve. So, how did anatomy impact surgery? Now, one thing that was very interesting is that in the 1300s to 1500s, dissection began to be practiced in Europe. At one point, there was a papal bull that said, you can't boil the bones of dead crusaders and send them back home because it's cheaper. You actually have to attempt to bring the entire body back to Europe for their burial. And crusaders had been boiling the bodies of dead crusaders to send them back because it was cheaper, far more convenient. What a lot of people interpreted that as was a ban on cutting up the body and dissecting in general. But it gradually became more and more kind of normal in medical and artistic areas of the university so that people could understand how human form worked. But even then, this dissection was not done to investigate and really understand the human body. It was pretty much there just to say how wonderful Galen is and how he really saw everything. And aren't we all glad that he wrote these books for us? And in fact, the book is front and center. We have the professor in the podium professing. I guess I should stand here for this portion. So the professor is out there professing the truth of Galen, probably not even looking at the body. The person looking at the body is the instructor, and he's this guy here, guy with the stick, and he's pointing at various parts of the body, but he is far too high status to actually touch this body. So who's doing the work? The barber or the butcher that was contracted with to come here and help out was the person who actually cut. And this person probably had no idea what the professor or the instructor were even talking about, probably illiterate, probably unable to actually follow the line of reasoning they were trying to get across, and it wasn't really that important anyway. Look at the students in these pictures. They're barely even looking at the body. It's not a matter of looking to verify, looking to see that anatomy is complicated. It's looking just to have a demonstration that, okay, Galen's right, and everything agrees, and the instructor can point to stuff, and we'll take it on faith that they know what they're talking about. So we have roughly 200 years of fruitless dissection, as one medical historian has put it. So what changed? Andreas Vesalius, professor of anatomy at Padua, has been mentioned already. He grew up in Brussels and actually lived he lived on a hill, and to get to town he had to walk past the scaffold where they hung criminals. And in Belgium at the time, they would just leave them up there until they rotted away and their bones fell off. And as a kid, he would walk past there and steal a leg, kind of pull down the bodies, look at the ligaments, look at the bones, and as a result, he knew more about anatomy through sheer tactile investigation than almost any other physician that could be nearby, because he'd actually looked at these things and seen the process of decay and how the muscles, the ligaments, and the bones actually fit together. He became professor of anatomy at Padua after he graduated, and he decided he didn't like the way that he'd been taught, with the professor droning on, some guy pointing at stuff, and no one able to actually see what's going on, and the butcher just kind of throwing stuff around. He wanted to make it clearer, so he brought an articulated skeleton down when he'd lecture. He'd actually try to show people what was there. And in the process of investigating and teaching, he found out that Galen was just wrong about a lot of things. Muscular attachments were way off. Skeletal details were wrong. Blood does not transit between the left and right side of the ventricles. In some animals, there is an actual interventricular septum with perforations in it, but not in people. And the rete mirabile, this structure that Galen theorized was absolutely essential to create the pneuma that would actually move your muscles, Didn't exist. Some animals had it. There is actually a network of blood vessels at the base of the brain of certain animals, but humans don't have it. And that's a big deal because it was the centerpiece for his entire concept of physiology and anatomy, and it's not there. So he was struck by so many of these problems that he eventually realized Galen made so many mistakes because he never looked at an actual human's anatomy. He looked at apes and other animals because he wasn't allowed to do dissections on human beings. Or as Vesalius is said to have remarked, that Galen was misled by his monkeys. So what do we do now? Vesalius didn't just come up with the problems. He was working with a medical illustrator named Stephen von Kalkar to make sure people could see the differences. Now, anatomical illustrations before Vesalius came along were something like this and that. Now look at the left there. If you're coming up with a doorway illustration to scare people on Halloween, that's not bad. There's kind of a skeleton there. Not quite sure what's going on with the femoral heads. Looks weird. But it's a skeleton, but does it, just think about bones. Does it really even schematically make much sense? But this is what was passing for anatomical illustration at the time. Here on the right, we have something that was actually produced very close to Vesalius in the 1490s. And it's absolutely nonsensical. It's not tied to actual human anatomy. Look at the heart. It's way over to the left. I think that's the liver on the right. I've got no idea what's going on up in here. And it's basically showing this confusion of vessels and things leading to and from the liver, the heart, and there's no real correlation to real human structure and function. Now take a look at what Kalkar and Vesalius put together in De Humani Corporis Fabrica on the makeup of the human body. These illustrations were not just a big step forward for anatomy, they were a big step forward for medicine and art. This is actually considered a breakthrough in artistic creation, not just in the medical world. So how do you think all this went over with Vesalius's contemporaries? Yeah, terribly. He was attacked from all angles for daring to refute the authority and the accuracy of Galen and Aristotle and these great thinkers. And Vesalius had a lot of things in common with Galen. He was really, really arrogant. He was also really loath to suffer people contradicting him. He really got upset quickly and held grudges. But unlike Galen, he said, hey, here's what the anatomy is, and if you don't believe me, here's what you do to go verify it. He gave people a list of steps to follow. He said, you don't believe me, fine, but you can go look for yourself. You don't have to take my word for it. And in the way, Vesalius, rather, is one of the first people to break out into what we would consider a contemporary understanding of science, where it's not enough just to say what's there. You have to give people ways to replicate your findings. So he eventually got tired of dealing with these contemporaries who attacked him, and he became one of the physicians to the Holy Roman Emperor, moved to Spain, and eventually died after a pilgrimage to the Holy Land after his boat capsized off of Greece. Now next up, in France, we've got a guy named Ambroise Paré, new barber surgeon on the scene. Not quite that kind of barber, maybe a little less bloody. So Ambroise Paré, this is his book, and this is a very famous illustration. There's several versions of it. This is called A Wound Man, and it's a way of advertising the contents of this book. This is the table, this is the table of contents for this book. Like, buy this book and I'll teach you how to deal with club wounds to the head, axe strikes to the chest, hammer strikes to the arm, and so forth. It's a way of saying, like, this is what is going to be contained in this book. Now, Paré was a poor French peasant who actually was trained and went through university, got a little bit of education, but he was not able to compete with or get access to the surgeons of the long robe in France. Surgeons who wanted to be more like the physicians, so they wore long robes, they worked in universities, they wouldn't touch people. They wanted to be surgeons who were more like their medical counterparts. And one of the things you had to do to gain access was to be able to speak Latin and write Latin. Paré did not have that kind of training. So he became a surgeon of the short robe. Thank goodness we don't divvy people up based on experience with long coats and short coats anymore. Sarcastic aside. So Paré was unable to join the academic surgeons, so he joined the army as a surgeon instead and got a lot of practical experience in dealing with wounds, illness and so forth on the battlefield. And he was a lot like Vesalius in the sense that although he was a little bit arrogant and tooted his own horn endlessly, he had to, and he had a very experimental approach to his work. In particular, at one point, they were treating people who were being injured by gunshot, and gunshot was a brand new thing on the battlefield. And one thing that they assumed was that if you got shot and you had the bullet inside of you, you also had gunpowder residue. And it was felt that the gunpowder residue was far more dangerous and it could poison you than the actual bullet. So how do you deactivate gunpowder residue? You pour boiling oil into the wound. Yeah. So one day, Paré is doing his diligent work. He's doing what he's told. He's trying to treat people with what he thinks is the standard of care, which is pouring boiling oil into their bullet wounds. Doesn't get any better, no matter how many times I say that. And at one point, he ran out of oil. He's like, oh no, I'm a terrible surgeon. I'm really letting my patients down. So instead, he extracts the bullets and he puts a poultice on them, included things like turpentine and egg whites. He just kind of made it up as he went. And he was convinced he'd just doomed these people. And the next day he came in, and lo and behold, these guys had better healing going on, less inflammation than the people who had boiling oil put into their wounds. No surprise to us, but this was a shock to him. And it set off a reaction in his mind that he questioned everything thereafter. And he started really investigating how to make things better, not just doing it the way he was told, but how to make it better. So he wrote several works, including a major surgical treatise and text. He reintroduced ligature. He was pretty well read, even though he couldn't read Latin. And he would, do things like look at new ways to heal wounds, new ways to do procedures. He brought the ligature back into fashion, not just cauterizing, but actually tying off arteries that were bleeding. And at one point, he became so popular with the soldiers because he actually treated them. He didn't just let them die. He treated them in ways that worked, that there was a French city that was under siege. And instead of trying to sneak the soldiers out, it was easier to sneak him in. And there was a parade when he got into the city because the soldiers were so happy that he was there and could actually help treat their wounds and their comrades. So he really tried hard to do things well, and he investigated fractures, dislocations, wounds, wound healing. He decided that it wasn't really a good idea to remove people's testicles as you were trying to treat their hernias. Thanks for that, Ambroise Paré. So he really did try hard to improve the quality of surgical practice that was involved and distributed his findings in written work. One thing that is interesting is after his career, the French king actually was so impressed with him that he basically strong-armed the academic surgeons to let him into their club. So he became a surgeon of the long robe eventually, strictly because he was so capable and they were so incapable of actually doing anything worthwhile. So at one point, the French king, who was named Henry II, was getting his daughter married to Philip II, King of Spain. This was actually a relatively dramatic thing because Henry II had been held hostage by Philip's father his entire childhood. So he was actually not too well disposed to the kings of Spain. But to make peace, Henry II's daughter was going to marry Philip II. And during the celebration, there was a lot of jousting. And Henry, jousting, had a massive accident and had a jouster buckle, and the jousting lance went through his helmet into his eye socket and out into his skull. He didn't die, so they brought him, the king, into an area to lay down, and Ambroise Paré tried his best to actually deal with this. And lo and behold, Philip II's court physician, Andreas Vesalius, was there too. Now, they both tried really hard to come up with a way to treat the king, and they actually used decapitated heads of condemned prisoners and replicated it, jamming lances into their eye socket and say, okay, what can we do to help the king and maybe fix this? Eventually, the inevitable happened. An infection took hold, Philip died, but Andreas Vesalius and Paré were in the same room working on the same project for a while. Now, a lot of people are asked if they had a time machine, what would they do? Like, oh, I'd go see the signing of the Declaration of Independence. I'd go see the founder of my religion go and preach in person. Where would I go? I'd go right here. I'd go see Ambroise Paré and Andreas Vesalius working on the same case at the same time back in the court of Philip II. That's just me. Now, speaking of weird things that happened, one thing we'll note during surgery is there's a lot of false starts and a lot of things that could have been but didn't wind up happening. Early on, around the same area, people had actually come up with the idea of vascular grafts and using a little pedicle of skin, making sure you maintain its blood supply, and grafting it onto another part of the body and then detaching it. A common punishment for various crimes in India, China, the Middle East, and Europe was to cut someone's nose off. Because if you get your nose cut off, it's pretty clear that you've had a run-in with the law. No one can really argue that you did something. But people would try to get that replaced, and they would actually do a vascular graft with the skin of the arm, and they'd kind of be locked up like this. And once the vascular graft grew and healed into the skin of the nose, they'd cut the stump and then fashioned it into what kind of sort of would look like a nose. I can't imagine aesthetically it was quite the same, but this was a very popular procedure for a while. The procedure was actually so frowned upon because it was either mutilating the body or giving these criminals kind of a free break, that the Catholic Church came out against it and actually had the inventor of it, Tagliazzi, disinterred from his grave and put into unconsecrated ground because it was thought to be a very shady thing. And vascular grafts did not come back for a very long time. Now we're going to jump a little further ahead and talk about surgeons in various countries. In England, the physicians, the barbers, the barber surgeons all had a very contentious relationship. And there was a lot of animosity between them. And it wasn't until Henry VIII really chartered them all that there was a little bit of peace. Everybody knew, okay, here's what we're supposed to do. You guys handle this task. You guys handle that task. We'll not poach off of each other's area. So Henry VIII, if you don't know much about history, if you think about a famous British king, this is probably the one you're thinking of. Had all the wives. So Henry VIII really brought surgery forward because it wasn't left behind. He made surgeons, maybe not on par with physicians socially, but he made them, there was a Royal Institute of Surgery at that point. They had some respectability. The British surgeons received 2 bodies every year for dissection and investigation. So the whole country, 2 bodies. In Scotland, the surgeons in Scotland got 1 body, but weirdly enough, they also got the whiskey distribution rights for the entire city of Edinburgh. So 1 body, but if you're giving whiskey to Scotsmen, and I can kick my own people, if you give whiskey to Scotsmen, you're going to make a lot of money, and the surgeons in Scotland did. So the University of Edinburgh became a major hub for anatomy and surgical research, and there was actually a group of 3 relatives, father, grandson, great-grandson, who were the heads of anatomy there for about 126 years. So you got Alexander Monroe I, Alexander Monroe II, and Alexander Monroe III. And this family basically headed up anatomy and surgery at the University of Edinburgh for over a century. And in terms of their efficacy, Alexander Monroe Primus, the first, was really good. His son, the second, was even better, and the third was just terrible. Apparently he would just lecture from his great-grandfather's notes, wouldn't even really do any dissecting, although he was apparently filthy all the time and had like little bits of flesh stuck to him from surgeries and dissection. So just a gross person. Wasn't really cared for. I equate these guys to the original Spider-Man movies. First one, hey, pretty good. Second one, yeah. Third one, oh man, it's terrible. So, because there was so much anatomy and surgical training going on in Scotland, stealing bodies became a major, major cottage industry. People were stealing bodies all the time because you can't train all these anatomists and surgeons with 1 body per year. And people would do anything to get a hold of these bodies and to keep their relatives from having their bodies stolen. In particular, we would have mort saves. They'd put cages above the graves for a couple weeks until the body would be too decayed to be useful anymore, so that they wouldn't have body snatchers going in and breaking it open. And they were actually really good about it. The body snatchers would just dig a small hole right about at the top of the grave, break the lid, and they could just lift the body up by the shoulders through the smaller hole. So they didn't have to dig an entire grave-sized hole to get at these bodies. So a couple people, most famous in this area, were called Burke and Hare. So Burke and Hare were Scottish inn owners. They kind of ran an inn. And they decided, selling bodies to anatomists is really pretty profitable, but the problem is you got to wait for people to die. What could we do to speed this process up a little bit? So they started murdering people who stayed at their inn and giving the bodies to a guy named Robert Knox, who was a surgeon at the University of Edinburgh. Now, Robert Knox it's been said he didn't know what was going on, and yeah, sure, but he didn't ask any questions either. These guys were only caught when they killed a very well-known local street person, like a street performer, and the students at the University of Edinburgh were like, that's Eddie. That's Eddie's body. I saw him like yesterday. And so it was very obvious at that point that he'd been murdered and sold to this school. And so what happened then was that Burke and Hare were arrested. And if you're intrigued by this, I wouldn't say it's the most historically accurate thing, but there's a hilarious comedy called Burke and Hare starring Simon Pegg and Andy Serkis, so check it out. I could watch Simon Pegg read the phone book, so if he's stealing bodies, that much more fun. So what happened? Well, Hare turned state's evidence, Burke was hanged, and as punishment for his crimes, he was given to the surgeons and dissected. And you can go see his skeleton in the Royal College of Surgeons in Edinburgh. And in addition to that, they also bound books out of his skin. There's one right in the center. It goes by the fun name anthropodermic bibliopexy, making books out of human flesh. There is a term for that. So, moving from Scotland down into England, we have the Hunter family. Now, William and John Hunter were brothers, grew up in Scotland, but William Hunter moved down to London and became a very well-known obstetrician and anatomy instructor. Anatomy instructor, and actually opened up his own anatomy school. And it was there he had a lot of success and eventually brought his brother in to be able to help teach. And his brother, John Hunter, didn't really care too much for a lot of the textbook learning. He didn't do well in university, but he was very practically minded. And once he started dissecting and teaching, he just got absolutely ravenous for more and more knowledge. So he joined the army, came back, trained with some of the best surgeons in England. Can't go into their accomplishments right now, but William Chesterton, Percival Pott, very well-known surgeons at the time. And then John Hunter started teaching with his brother and eventually started his own school teaching anatomy and surgery. And he took the practice of surgery from that low level of respect and prestige and brought it on par with physicians. In the course of his lifetime, his work alone made surgery respectable in London, and England in particular. So how did he do it? He worked tirelessly, did a lot of investigation. He'd dissect, he'd work on solutions to clinical problems, he'd write down, publish, he'd teach his students, and part of the day they'd dissect and do some of his work. During the rest of the day, they'd summarize the findings. And he was a machine for research. But as part of that, he took an already fairly ridiculous demand for stolen bodies and turned it into a circus. People were just having to work very hard to supply him with all the bodies he needed for his investigation. And in the process, he did some things that are not just iffy, they're just downright criminal. At one point, he was at a sideshow and he saw someone with gigantism. This guy named Charles Byrne, who was an Irish person with gigantism who came to London and displayed himself at a sideshow. And John Hunter, being the not terribly tactful person he was, approached him and said, "When you die, I want your bones." And Byrne was horrified by this because he thought that his body needed to be intact and not broken up so that he could be brought forth on Judgment Day. So he knew Hunter was after him and his health was terrible. He knew he was about to die, so he told the undertaker that when he died, he was to be buried in a stone coffin and thrown into the sea. John Hunter counter-bribed the undertaker and then followed the funeral procession to the sea, and when they stopped at an inn for the night, with the undertaker's help, they opened up the stone coffin, pulled out the body, put it in Hunter's cab, put stones into the stone coffin, let the funerary procession proceed, and within a couple hours, the body was boiling away in Hunter's basement, and his skeleton is still present at the Hunterian Museum in Scotland today. So Hunter did these amazing things, but a lot of it was really sketchy. Now, amongst the amazing things that he did, he investigated as much animal anatomy as human anatomy. That's not a museum, that's his house. He had this gigantic viewing room built for all the anatomical specimens that he had created. People would tour it. It was a teaching facility, and it is now a museum because he donated all of it to the Royal Society for Surgery at the time of his death. So he did a lot of comparative work. He was instrumental in founding the Royal College of Veterinary Sciences and Veterinary Medicine. He actually did something controversial at the time and said that mastodons had gone extinct because their teeth were clearly different from elephants. At the time, it was felt that no animal could come into existence anew or become extinct. It was just impossible. He also anticipated evolution by over 70 years. He put forward the idea that there was permutation and that animals changed through geologic time. Now, he didn't completely anticipate Darwin because he didn't propose a mechanism like natural selection for this, but this was considered to be so controversial that the Royal Society of Surgeons held this paper back for publication, and they only published it after Darwin published, and then they printed it about 2 weeks later and said, oh yeah, Hunter said that too. So kind of missed the boat there. But really active mind, did a lot of amazing things. Here's what I think is probably the best book on Hunter. If you find yourself intrigued more than horrified, or more horrified but you like that, it's really a good appraisal of not just his work, but just the moral ambiguity he brought to things. His career didn't just involve stealing bodies and anatomy research. We'll finish up on Hunter. I'll turn you guys loose. We'll finish up the rest of this another day. Sorry for the late start. We just had a technical glitch. But he did a lot of auto-experimentation. He didn't just victimize the dead. He victimized himself. At one point, he was falling asleep at night and he still wanted to work more, so he started doing jumping jacks and he ruptured his Achilles tendon. Now, if you rupture your Achilles tendon at night, what's your first instinct? Ow. His first instinct after ow was, you know what? I need to chart how this heals. So he charted how his healing went. Then he started rupturing tendons of mice and other animals and charting how that went. And he described tendon healing, wound healing accurately for the first time. Oh, what else? At the time, there was a major controversy whether syphilis and gonorrhea were the same disease or different diseases, because if you had one, you likely had both. And it was unclear which one was which and if they were in fact the same thing. So Hunter wanted to come up with his take on it once and for all. So what did he do? He found a sailor with syphilis. He scraped some of the syphilitic pus from the sailor's penis, and then he scratched on his own body and infected himself with syphilis to chart the course of the disease and how it went. Now he then said, okay, syphilis and gonorrhea are the same disease because he charted his course of progression of symptoms as time goes by. Unfortunately for him, the sailor had both chlamydia and syphilis, so Hunter was wrong on this one. So he tried to figure out how gonorrhea and syphilis work by giving them to himself. And last but not least, he died. He had heart problems, and he would describe angina. He'd have anginal attacks, pain in the chest and substernal. And at one point, he was having a fight with the administrators of the hospital where he worked, and he had a heart attack. And his reaction was to run to the mirror and start writing down what was happening, and that's how he dropped dead. He was trying to chart the course of his anginal attack, and in fact, it turned out to be a fatal myocardial infarction. So that's pretty much how Hunter brought surgery to respectability in England. We'll pick up again starting at this point. We will finish up this cycle and come to France and the modern era.